Good afternoon, everyone. I'm Avon Fire Chief Bob Spur here with an update about what's going on with COVID-19 in Avon. Joining me always is
Kathleen Waldron, the health agent for Avon.
Hi, Kathleen. So, quick by the numbers. Nationally, we are at 369,071, and fatalities are 11,032. That's as of the time we're filming this, which is April 7th, 2019. 2020 at 2:19. That's where I got the numbers messed up. So it's 2:19 in the afternoon on April 7th that we're filming this. Statewide, we're at 13,837 positive with 260 fatalities. Kathleen, how's it look more locally?
Norfolk County has 1,382 positive cases. Plymouth County has 1,067 positive cases. Locally, we have 11 positive cases, but I do think it's important that 4 people have recovered.
Excellent, excellent. So there is a path to recovery here for many of these people. You know, the fatality number is a very small number of the overall, actually. What's going on here in town? What are people need to know?
Same things are going on in town. Buildings are closed. I just wanted to touch base. I know in one video I touched base about the difference between quarantining and social distancing. I wanted to let residents know that there's a difference also between isolation and quarantine. Isolation is for people who are having symptoms or showing symptoms or who have tested positive. And if you're in isolation, if you're in a household with other people, you should be isolated to one room. There should only be interaction between the positive person and one other family member. And in those cases, you want to use protection, masks and gloves for anyone that's caring to that positive person. When there is a household contact with one positive case, the rest of the family does become quarantined, which means they can move freely throughout the house, but they can't go for walks. They can't do like outdoor activity. They couldn't go to the park. They can be outside in their own backyard, but they're quarantined to their house. And they're quarantined for 2 weeks because they're still saying the symptoms show within 2 weeks of when they're in contact of that symptomatic person. So I hope that helps a little bit. And then another thing too, I just wanted to touch base, it is still very important to social distance because if I tested positive and I was kind of reckless and going to work every day, going to the grocery store every day, going to see my grandmother, my friends, my family, anyone that I've been in contact with is now potentially exposed to the virus. And they're saying it can shed up to 2 days prior to when the symptoms are showing. So it's even more important to stay at home so you're not spreading it unintentionally.
So I think that's something that's important for people to realize. Kathleen and I are in separate closed offices. We're kind of in a one-on-one situation at the moment. Even around the firehouse here, we're masks all the time, even just walking around here. If we're interacting with anybody else anywhere, it appears to be very droplet based still. The masks are really key, and the mask is protecting you from me as much as it's protecting, or more maybe even than it's protecting me from you. It works both ways. You're helping yourself and you're helping the other person. So masks are really important. Kathleen, one quick thing you and I were talking about a little earlier is testing. And the people that are quarantined for 14 days because someone else in the house is sick, you wouldn't necessarily want to test those people to say, hey, you're good, because they may not have enough viral load at that point to test positive, even though they have been significantly exposed. Have I got that right?
Yeah. I don't know how to say this too, but if you're in contact with someone who's tested positive and you show symptoms yourself, you should contact your doctor, but they may not test you. They may assume that you have it. You're already been quarantined. You're going to stay. You're going to now become in isolation, so you should remove yourself from the rest of the family if possible. It's kind of like a chain effect.
Yeah. One other thing, have you got a message from the town clerk that she wanted put forward?
Yes, I do. And I also wanted to comment too, although masks and gloves can be important, try to remember that I've still seen people touching their face with their gloves on, eating food with their gloves on, which defeats the entire purpose of wearing gloves. So you just want to, it's more self-awareness.
Right.
Keeping your space, keeping your distance, covering your cough, all that stuff we've mentioned before. And I'll read the message from the town clerk's office. In response to the state of emergency and concerns about COVID-19 and its implications on election administration, the governor signed a law authorizing the Board of Selectmen to vote to postpone the local election, which was scheduled for April 14th, 2020. The law established that the Board of Selectmen must announce the new election date within 20 days' notice, a new voter registration deadline of 8 p.m. on the 10th day before the rescheduled election. The Board of Selectmen will follow the direction of health officials on establishing a new date for Avon's annual election, which has still not been determined. The law provides two alternatives to voting in person on election day. The first, the law allows any person taking precaution related to COVID-19 to vote by absentee ballot. The second, the law provides early voting by mail. Applications for early voting ballots must be received by the town clerk by noon the day before the election. Any voter may obtain an early voting ballot. Both absentee and early voting ballot applications can be found on the town website. The Board of Selectmen also voted to delay Avon's annual town meeting, which was scheduled for May 5th, 2020. That date has not been set either.
Excellent. So the board took action on that pending the governor signing this. They took action on it April 2nd at their meeting. So now the governor has signed it. That becomes effective. The board's actions from the second kick in, which is great. You know, the more social distancing we can do, the better. We will have time to get these elections in. It'll work out. Okay, I think that's our wrap up for today. Avon, like normal, you're doing great. Keep it up. Our numbers, we keep seeing that projection push farther and farther out, and that's actually a good thing. It's flattening the curve out, keeping the load lower on the hospitals, which is what we need for people. So you're doing great. Keep it up, and get out there and look for those teddy bears in the windows. Have a good day.